Hello, my peeps. Here again. Wanna share some insights. Today, I want to talk about. Let's see the dangers of persistent, non-resolving, right? Vaginal discharge. Let's talk about persisting vaginal discharge. There are some discharges in our vagina that we pretend to be normal, but rather they aren't. Hizo uchafu yanayotoka kule punjetu, saa zingine si ya halali ya kudhihirisha uhai mwema kule chini. Pardon. Not all vaginal discharges are normal. Your vaginal discharge should not have odor, haifai kunuka, should not have color, and should not be accompanied by itchiness, and should not be more that disturbs your conscience. Happy moment. Discharges at times could be presumed to be STIs, but not. Some of which are correct unless they are tested, they are cultured, and even more invasive cytology screening. I say this because at times you get a client at the end stages of life-threatening diseases that when you get the story from them, started by being treated for persisting yeast infection. Yeast infection, yes, are persistent in treatment. They are fungal infections. But a high vaginal swab for testing culture and sensitivity should be done on the second visit most of the times when the discharge is more persistent, that the patient or the client is not even satisfied, is not even comfortable with having herself, the vagina itself. He presumes to have the penis, whom they couldn't know the complication of having the penis, right? The disadvantage of having the penis. I wish you knew before you lamented on your vaginal health. When the vagina is overproducing whitish, greenish, or bloody discharges, listen here. When your honeypot is producing greenish, yellow, whitish, creamy discharges, at times itchy, at times foul smelling, and it has been persistent that you treat it more than once every 2 or 3 months, or even 1 month. First of all, you should check on the hygiene. Second, predisposing factors. Are you multisexually active? Are you doing or practicing dodging? Are you self-satisfying person? Are you having an IUCD, the coil? Is your partner faithful to you, or having a polygamous life, or is promiscuous, something like that? Yeah. Should check on the risk factors first. When you get to the hospital, your privacy always matters, but your health must be your first priority. Most of our clients that neglects the directive or the insights of their gynecology or physician's review or examination, ending up being treated for normal vaginal infection, the yeast or candida, but assuming there are more risk factors that predisposes the patient on the persisting vaginal discharge. That's to say, when someone tells you, please get down your private clothing, doesn't mean this person is enjoying seeing your private parts. In essence, they want to collect perhaps the sample for testing. They want to do a high vaginal swab. They want to do a pap smear. They want to do a villi for further investigations. At times, high vaginal swab, the villi or the pap smear, during the extraction of the samples, one or gynecologist or physician or your doctor will always advise for a biopsy if there are changes on your cervical tissues. There are physical changes that could further entertain further investigations. That's to say, an invasive procedure. When this is done and there are sites of positivity, you will be advised accordingly if you need a medication. You need a further specialist depending on the cytology results. A further specialist depending on the lab results, and even could recommend further imaging, MRI or CT pelvic abdominal, to rule out the inversions. That's to say, let's be keen when we go on checkup, and our advice, if you are sexually active, please adhere to yearly cervical screening to rule out the invasive diseases. Thank you for now. See you next. Bye.